First Baptist Church, Toronto, but we are much more so a community church as well, and very caring for the community and what's happening in this last year of virus. So we're going to have some experts on the line. We already have Dr. John Oyston on the line, and we have a couple of scientists, Dr. Krishana Sankar and Dr. Kimberly Gauthier. Oh, that's Kimberly Gauthier. I was wondering who is this beautiful lady chiming in at me. Welcome, Dr. Kimberly. And do we also have Dr. Krishna will be joining us very shortly. Ask God's presence to be with us today. Father, we just invite your presence and thank you for this opportunity of knowledge and understanding of your creation and your creative power. We understand the challenges, Lord, for us to understand deeper and deeper what you're about. But Lord, you gave us all the expertise we have in the creative minds of doctors, nurses, and scientists, medication, technology, and all the above, that we seem to take for granted time and time again. But we thank you because you orchestrated your plan for this universe, and you care for every one of us, Lord, as humans, much more than the divide we're seeing of competitiveness and judgments. So we thank you we can have on this platform today your great minds and knowledge to help us understand, Lord, this particular virus that is consuming us in this pandemic, and the hope that you are giving to all of us in this opportunity for medical intervention and for healing in our bodies, mind, soul, and spirit. I thank you for Dr. John and Dr. Kimberly and Dr. Krishna, hopefully as well, for being with us tonight and sharing with us, and for all those who will join us as well. Open our hearts, open our minds, open our understanding to hear what you say to us through these wonderful, wonderful gifts that you've given to us. And we thank you for your time with us tonight again, and for each other as fellowship together. Even though we're distant, we are yet unified in spirit and in our own thoughts and emotions. So bless us now, I pray, and we give you thanks. In Christ's name I ask. Amen. Amen and amen. Well, let's dive right in. Dr. John Oyston is a physician, a retired physician, anesthesiologist as well, and he has joined us today as part of the team with the COVID-19 Resources Canada. So thank you guys as well for your volunteering and service you offer through this resource through Canada, and for responding. I want to say special thanks to Grace Kim, who was the secretarial coordinator who arranged this for us tonight. And I started off by asking Senator Wanda Thomas to help me with this plan, and Senator Wanda Thomas put me on to Senator Rosemary Moody, who's also a physician. And Senator Rosemary Moody, her office contacted me and put us on to the Resources Canada, and voila, here we are tonight. So thank you both as well, and hopefully we'll see Dr. Krishna pretty soon. So Dr. John, we've got some questions here, but beyond the questions, I will have you take it away and give you about 15 minutes or so to impart to us understanding on this vaccine.
Okay, so we don't normally do this as a presentation. We normally do this as more like an open mic night. And so the way we normally do it is we just take questions as they come up, and then usually one of the experts will answer, and then the other expert will add anything else if they have a need to chip in. So the questions that you presented us with are very typical of the sort of questions we're going to get asked.
Okay.
So what I might do then is I'll do the first question, and I'll see if Kim wants to add anything to that. And then I'll let Kim do the next bit, and I'll see if I have anything to add to that. And if people want to chip in with, add-on questions or anything else as we go along, that's fine. Is that okay with you, Kim?
Great plan. I like it.
Okay. The first question is, how real and dangerous are the COVID-19 and other strains without a vaccine or intervention? The SARS-CoV-2 virus, the virus that causes COVID.
Oh, sorry.
Yeah. It's quite unusual amongst pathogens in that most times things that cause disease cause a relatively standard disease amongst all the people who get it. And it's usually within a severity range. Whereas COVID can present in a variety of ways. So people can have something that's almost completely asymptomatic. They can feel almost entirely well, which is unfortunate because it means they can then transmit COVID without being aware that they had it. So for many people, it's a very mild flu-like illness. Then it can get worse than that. It can be like a very severe flu. And then it can have severe respiratory symptoms with shortness of breath and a decrease in oxygen saturation, a decrease in the amount of oxygen in your blood. And then it can go on worse than that to a hyperinflammatory response and multi-system organ failure and death. Also in children, most children have relatively mild symptoms, but there is a version in children where they get an inflammatory response as well. And then finally, there's this thing that they call long COVID. So people can have COVID, they can recover from it. And just as people are often wiped out after the flu or after infectious mononucleosis, they can have months and months where they just don't feel right, they don't have energy, they have what they call a brain fog. So it represents a very wide-ranging degrees of pathology. In general, the younger people tend to suffer less. I think half the deaths are in people over 85. So younger people sometimes feel that it's not such an issue for them. But it is not only because they can transmit it, but also because of this issue of long COVID, which can be quite disabling. Within the strains, it appears that there are some strains that are more communicable, particularly the British strain. And also there's a suggestion that some of the strains are more deadly. And also, perhaps most worryingly of all, there's suggestions that some of the strains could actually reinfect people who were already experienced one of the first strains. And this is happening with what they call the P1 strain in Manaus in Brazil. If people get vaccinated, then people who get vaccinated usually don't get COVID at all. I mean, the vaccines are 62% and up effective in preventing you getting COVID at all. If you're one of the people who do suffer COVID having had the vaccine, you tend to have very mild symptoms, you tend not to be in hospital, and it's pretty much a guarantee against needing a ventilator and dying. So the difference that vaccines make is enormous. So I think I'll leave it there and ask Kim if she wants to add anything.
Sure, thank you, John. I think that covers definitely a lot of the pathology of COVID, and I think you're a perfect person to answer that. I'll add a little bit, I guess, on context. You know, we often hear it's mostly, as John said, it's mostly more severe for people over 80. Certainly that's where the bulk of the deaths have been, but I think it's not the most helpful way to understand our risk by comparing our risk to other people. So I say our risk as someone under 80, someone under 30, barely, almost 30. You know, my risk is less than someone in their 80s, but it's not zero. And I personally think it's a little bit too high. I think looking at the incidence of people who end up hospitalized in Canada, people in my age range, it seems to be about 1 in 100 have been getting hospitalized. I think that's pretty high. Some people might think that's pretty low. So it really depends on your own assessment of the risk. But yeah, I think it's been very varied. I know some people who've had pretty severe illnesses, who have had symptoms for months, longer than 8 months. Sometimes some people are still sick after a year, and they're still waiting to get fully recovered. So it's been varied, and there are certainly some people who don't have very severe illness, and we hear a lot about that. And it's hard to get our head around this very confusing disease, but it is real. I think it is quite dangerous. It is certainly very deadly at a certain age, but it's also very severe in terms of the outcomes. When you hear in the news about our hospitals are filling up, our ICUs are filling up, this is mostly people in their 60s, 70s, and their 50s even, and younger as well. But that's the dominant age group. So that's getting quite young. These are, you know, parents of children who are filling up in the hospitals, and it's had a very devastating impact on families, I think.
Right.
Krishana has joined us as well if she wants to chime in.
I just noticed that. So thank you and welcome, Dr. Krishna. Am I saying it correctly? Dr. Krishana Sankar.
Yeah,
nice
that
to
was
have.
excellent. You pronounced it
Well,
perfectly. Thank you.
nice to have you. And you're a scientist with the communications lead and program manager at COVID-19 Resource Canada. And it's great to have the three of you as experts here sharing with us tonight. And for those who are listening in right now, we welcome these three on our midweek service tonight, but it's more of a community informative session on vaccines. So thank you so much. You got the questions. We're just answering the first question right now. We're moving down the list. And I think based on what Dr. John says, you all will take turns with each question, and then the others will kind of chime in afterwards if there's a further response to what's happening. So we finished question one. Quickly, Dr. John and Dr. Kimberly and Dr. Krishana, the point in question one was this: with our community in particular, the Black community, but then, you know, the Hindu community, the Indian community, everybody's community, and all the concerns about what's happening, social media, the rhetoric of the church, and all the stuff about, you know, we're going to get to some of those concerns later on. But then the bottom line is this: if there wasn't any kind of resolution into solution or intervention or vaccine, right? The bottom line is this: it will eventually eradicate almost humanity. Am I correct? I mean, if we didn't do something about it, okay, because we all are hearing all the rhetoric about vaccines, maybe good, maybe bad, but if nothing was done at all, and we've already got, I just checked the stats here, we've got 2.7 million people died already, and 121 million, 0.7 million with the cases. So my point is without any intervention, so on, right? Number one probably would be a reality, wouldn't it?
I
I don't
don't
think
think
it
it
would.
would be.
Sorry, we're going to say the same thing. You can go ahead, John.
Yeah, I don't think it would be quite that bad. I think the young people would survive. So it might wipe out the people, it would probably wipe out the people 80 and above. It might really damage the people in their 50s and 60s. And it would get rid of some of the people in their 30s and 40s. But, there would be plenty enough people left. You could even argue that there's too many people in the world anyway.
Right, and that's what some of the issues are. All right, let's move to number 2. I'm not sure who's taking number 2.
So what are the various vaccines available and approved? I can jump in here and then, yeah, sure. So right now in Canada, we've got Pfizer and Mrna that are the mRNA vaccines, and the AstraZeneca and the Johnson & Johnson vaccines that are viral vector DNA vaccines. So those are the 4 vaccines that we have available and approved here in Canada right now. That was a pretty easy one to take.
Yeah. Others?
Do you want to do the follow-up, which is the effects of the vaccines against the various variants?
Yeah, sure. So this is an excellent question. The reason why I was a little bit late, I was doing another vaccine Q&A. I just came from that, and so this is another one of the questions that came up. So right now, there are ongoing studies happening for all 4 of those vaccines. So all of the vaccines that are approved, the companies have to continue studies into how effective they'll be towards or against the variants. Right now, and I think maybe Kim and John can follow up on this in terms of actual numbers. I think primarily right now, or preliminary data is saying that I think the AstraZeneca, J&J, Pfizer, Moderna vaccines have some effectiveness against the B.1.1.7 variant. That is the variant that was first discovered in the UK. However, I know I personally saw earlier today, I think it was today or yesterday, that the AstraZeneca vaccine, preliminary data again, so very preliminary, doesn't seem to be doing as well against the South African variant. When it comes to Brazilian variant, I don't know the data against that. So I will say these vaccines do have some effectiveness against some of the variants, but once again, the research is ongoing. I will say this though, because I've had people who've asked, okay, so if we don't know, what's gonna, are these vaccines going to be effective towards the variants? Number one, a lot of the companies are also studying and trying to ensure that they create booster shots as well, right? To pretty much combat the variants. So that's something to think about, is you're going to still get these vaccines, but then when the booster shots come out, you get those too to help you protect against the variants. And then the other thing is this analogy that I've seen one of my colleagues use in print, and I think it's a really good analogy, is if you're in winter, you need some kind of protection, you have a coat. It's better to have a coat than no coat at all. So it's better to have a vaccine, and then when an even better version or an updated version of that vaccine comes out, then you get it and you have further protection. So that's an example of you putting on gloves, hat, and a scarf, right? So you need to start with some layer of protection, and then as we go along, once there are more and more booster shots that are being made available to us to increase effectiveness of the vaccines, then we take that and we get further protection against any of the variants of concern. So that's how I'm going to tackle that one.
All right, excellent. Well, number 4 is a big one. Go ahead.
So should I take that one, or does anybody? You want to go, Kim?
Yeah, I'll take this one. So the question is, are there any merit to some of the concerns on the effect of the vaccines, and with 2 bullet points of developed too soon and mRNA and genetic coding? So I guess I'll start with the question, is there any merit? I mean, I think we all have concerns, and that's what prompted us all to, get informed, find the answers to our questions, right? We don't just take this blindly. Certainly we want answers, and we have those answers, and we're here to share them with you so that we can relieve any concerns that anyone else might have. So I'll start with the first bullet point of developed too soon. So this is something that we kind of tuned in to the development of these vaccines at a late stage. And it looked like it happened very fast. It looked like the virus came out of nowhere, and it seems like the vaccine came out of nowhere. But in reality, these vaccines, the mRNA vaccines that Pfizer and Moderna developed in partnership with other labs, as well as the viral vector vaccines that came from AstraZeneca and Johnson & Johnson, these technologies, these types of vaccines have been in development for decades. This is something that people have been working on for a very long time to target other viruses and to target cancer as well. Most recently, they were working on coronavirus vaccines using mRNA and viral vectors for MERS. So this was the Middle Eastern Respiratory Syndrome virus. That was something that came about, I think, 6 or 7 years ago. And they had a vaccine in development for that already. So then it didn't really go through because funding is always an issue. Once the virus kind of goes away, if it doesn't really take a hold of the whole world, then people stop paying attention and no one wants to be proactive, unfortunately, with their research. So when this new virus now came around, there already was a framework, a really good foundation that was already made that they were able to jump onto and just reprogram a little bit, because it's a similar class of virus. It's all coronaviruses. They're able to reprogram it and make new vaccines very fast. And in fact, the first in-human trial for the Moderna vaccine started a year ago yesterday. I was the first person who received a vaccine in the trials in phase 1. And that was 66 days after they received the sequence of the new coronavirus, that is fast, but it's also because of the nature of these vaccines, they're able to make them faster than normal. So that's the other point I'll add to that too, is that using genetic material, and I'll kind of answer this at the same time as answering the bullet point, the mRNA and genetic coding. So these vaccines are using genetic material, RNA and DNA. Traditionally, you'll use the whole virus. You'll either inactivate it, you'll kill the virus, and you'll inject that in the vaccine, or you'll use a part of the virus, so just a protein on the outside of the virus, and you'll inject that in the vaccine. What we're doing here with these vaccines is, instead of using the protein, we're using the genetic code or the recipe that makes the protein. Now, these genetic codes are very familiar to our bodies. In our cells at all times, our DNA, our genome, our DNA that hosts the information that make us, is being converted into short messages, little transcripts called RNA, or mRNA for messenger RNA. From that, you are able to make the protein. This is the recipe to make the protein. Another way to think about it is, if you're at a restaurant, the menu is your DNA, your food order is the RNA, and the food, that's your protein. So the food order doesn't change the menu, right? The menu stays the same no matter what. So these vaccines absolutely do not change your DNA. This is misinformation that's been spread online, unfortunately, but this is absolutely not true. It is not possible. The machinery required to change your DNA is not present in any of these vaccines. It cannot happen. So they are safe in that sense. They're not changing you, but they're just allowing your cells to do what they already know how to do. They know how to cook. They're little factories. So they know how to make this protein. So they're pumping it out constantly. And then they're able to stimulate the immune response. So your body now, your immune system, is going to see this protein from this virus and say, I don't know what that is. I don't like that. And they can launch an immune response. You can develop antibodies. You can develop immune memory cells. And that's what's going to stay with you. So the content of the vaccine, that's gone now. You've destroyed it.
Mm-hmm.
And the advantage of getting vaccinated is that the vaccine isn't fighting you back, unlike the virus. The virus is fighting you while you're trying to develop this immune memory. The vaccine isn't. So that's, I hope that answers both mRNA and the genetic coding question. If anyone wants to add anything, that was kind of a ramble.
No, I think you covered it really well.
Well, I have a follow-up perspective. Then maybe you can qualify for us the difference between mRNA and viral vector.
Yes. Should I take this one, or does anyone else want to jump in?
Go ahead. I mean, I think this was coming, and Kim, you can probably extrapolate. So the mRNA vaccine is literally what Kim was talking about, that mRNA piece. So
right.
Not the menu, but the food order. So that that piece of very temporary genetic code that's within the vaccine, that is the mRNA vaccine. So the viral vector is different in that the delivery system of it is different also from the mRNA vaccine. So for the mRNA vaccine, we've got like a fatty layer that encloses the mRNA in there that gets injected into you. With the viral vector, a vaccine, it's actually a dead virus that's then used as a vehicle to then that has the DNA inside, and then that is used to then be injected into you. So that's how they're different. However, just know that although it's a piece of DNA within that viral vector, that also will not go and that cannot go and alter our DNA either. That is also just being used once again as just the instructions to go into our cells to make the RNA and then to make the protein, and then that also gets degraded. So none of these things stick around in our bodies. They get into our bodies for a specifically short length of time to create the protein it needs to create that then creates this whole immune response, and then they just go away.
Right. And you can see from a faith community standpoint, understanding, the revelation story, the prophetic story, the end of the world story, how we marry this understanding with misconceptions and try to, persuade people, against the reality of what it is, because then you get the genetic coding, you get the DNA manipulation, right? And that's some of the WhatsApp, news and online stuff, the prophetic doom and gloom from my own counterparts of ministers and pastors and prophets. And I keep saying this: common sense, people, stop listening to nonsense and listen to common sense. Apply some discernment and biblical truth to what's happening, right? The mark of the beast, and they're going to control you. And so and of course you guys are, have your own biases as well, but I think common sense applies to the whole picture. But thank you for clarifying and enlightening the few of us who are on here, so we can enlighten others as well when we get all this nonsense passing around, that there's no DNA manipulation, there's no genetic coding going on here. So that's, I think, is clear enough for us, and it's on tape. We will make sure we use that. And Dr. John, go ahead.
Yeah, I'd just like to add a little bit more about the speed of the development of the vaccine, because that is a recurring theme. And it's true, because people early on, like this time last year, were saying the quickest we've ever developed a vaccine is 4 years, which was a mumps vaccine. So this is record breaking in to quite a marked degree. It's like 4 times faster than we've ever done it before. So there's a bunch of things that helped us. One is that the Chinese did the genetic sequencing of the virus. I think that was January of last year. So instantly we knew exactly what the genetic code of the virus was, and we knew what we were dealing with. And basically everybody realized this was a national, international emergency. And so there's no shortage of money. There was no shortage of volunteers wanting to take part in the trials. Because there was a lot of COVID going around, it was very easy to work out whether the vaccine was working or not. Because if you have some people who are vaccinated and some people who are not, the people who are not vaccinated are going to get COVID fairly quickly. The regulators, they paid a lot of attention to this stuff. Nothing was left sitting on people's desks while they went on vacation. And to be fair, they also did a thing called a rolling review. So instead of waiting for the entire study to be completed, they said, okay, we'll look at the first 10,000 cases, we'll see how that's going. And then, when you send in the next 10,000 cases, we'll take that under consideration. And when we have the 30,000 people that we wanted, we'll do a final review. But at that stage, we already understand your methodology. We understand exactly how you're reporting things. And so when we get the final cases, we can make a very rapid decision. And then the other thing is the manufacturers were prepared to actually do things, overlapping things, right? So they said, let's assume phase 1 works. Let's start on phase 2. Let's assume phase 2 works. Let's start on phase 3. Let's assume phase 3 works. Let's actually start manufacturing the vaccine. And if phase 3 is fine, then we'll be able to sell the vaccine. If not, we're prepared to take the risk and throw away a vaccine that doesn't work. So there was a bunch of reasons why people were able to get this almost miraculously quick vaccine development.
And Dr. John and Kim and Krishana, the thing too is, as a faith community, we are praying for it anyways, right? So I'm surprised that, we're praying for a solution to help the world, and when we get the solution, we're complaining and blaming that the world is not manipulating the solution.
I love that. I love that. That's exactly, yeah. That's exactly how I feel too, because I'm like, everyone's asking for it. It's here now.
Yeah.
It's,
Would you say technology played a great factor as well? I mean, 100 years ago with the Spanish flu, there was no technology like we have today. 20 years ago, there wasn't technology. So, I mean, yes, all of the above, but there's also a huge part to play with the technology we have, the advanced technology we have that moves
Yeah.
along as well. All right.
Yeah, you hit the nail on the head there. I think that's definitely another factor that played a huge role in it as well.
Okay,
and that
so
was
let's
key
jump.
also for the, oh, sorry.
Go
I was
ahead.
gonna say that was key for the collaboration too. There was people working on this around the world, around the clock. So getting, being able to communicate and just being able to do what they were struggling with some of these technologies in the vaccine, and just the effort and the focus and the attention that was given, they made huge breakthroughs. So it's great actually that we have these vaccines.
Yeah, it is great. I'm watching my time, but you know what? Our people are pretty good. And I think because it's informative and enlightening, time doesn't matter right now, so long as you guys are okay, because I want to get all these questions respond. The next question obviously is a big one, okay? Who's the expert, Dr. Fossey or Dr. PhD James from Kabutu Hutu Kutu Wata, wherever he come from, okay? I mean, they're all over the place, okay? There are a lot of experts out there, okay? Scientists, medical, even the pastors are an expert too, right? So tell us, who are the experts? The question here is, who really are the experts on the vaccine, medical science, and so on. And of course, the three of you are as well.
Exactly, we three are. But to be fair, I think the mainstream reporting in the Canadian media has actually been pretty good, and stuff that you read in the Globe and Mail, the stuff that you read in the stuff that you hear on the CBC, the experts that they have on the CBC. Those people have been pretty good, and I think the leadership in Canada has been pretty good. So I think we can have a lot of faith and a lot of trust in both our political and medical leaders in Canada.
Yeah, and I agree, because I think all you have to do is do a comparison. Like, just do a comparison of cases and death in other advanced countries. We 1/10 USA. So in spite of all the doubts and questions, I think we should be very proud of ourselves in the way we handle it. Yes, we are locked down, and yes, we've had to do a distancing, and yes, we can have church, okay, and some may be breaking the law if they can, but in the end, when all is said and done, we're very proud of the way I think Canada has handled it, and I'm proud to have you as part of this team that can enlighten us here in our small team group here as well. All right, let's move to the next one. Good. Now I have a nurse, Eula, is on the line, and I'm not sure if Dr. Nadine's on the line yet, but just to make sure, they are welcome to chime in, okay? Eula and Dr. Nadine, if you are on, you're welcome to chime in. And they had the questions as well. Number 6, go ahead. You can read it out to somebody.
Yeah, so what are the typical side effects? Go ahead. The typical side effects from the vaccine. Well, I had mine, as I said, on Friday, and I got on the range of things that are typical. So it's pretty much like the flu vaccine or other vaccines that people might be familiar with. So obviously a bit of soreness in your arm where the injection is that lasts for a day or two. A little bit sometimes of headache, sometimes with a mild fever. I actually went to bed with some chills, and I woke up in the night with the fever. I took some Tylenol, and in the morning I was fine. Some people have nothing at all. So there's a range of symptoms, but basically the vast majority of people really just get mild symptoms that last for 24, at the most 48 hours. Some people are saying they get more symptoms after the second injection than the first. But the vast majority of people get little or nothing, and it goes away in a couple of days, and take some Tylenol if you need to take something.
Okay. Any follow-up?
Sure, I'll add a little bit. The only things to look out for in terms of side effects are if you have any known allergies to any of the components of the vaccine. So the ingredients are all published online. They're on the Government of Canada website. You can find the full ingredient list. So specifically, if you're allergic to polyethylene glycol, PEG, PEG, if you're allergic, because it's in everything. It's in soap, it's in shampoo, it's everywhere. It's in lotion. I mean, I just looked in my medicine cabinet and I saw it in everything. So if you're allergic, you probably already know. It's extremely rare to be allergic to this, so it's not a big concern. So if you're allergic to that, then that's something to discuss, because you might want to take a different vaccine that does not have that component. If you've ever had an allergic reaction to a vaccine in the past, that's also something to discuss with your primary healthcare provider or whoever's going to give you the vaccine. Usually, so after you get vaccinated, you're monitored for 15 minutes. If you've had a previous reaction, you're getting monitored for longer, 30 minutes. And what they're looking for here is going to be an anaphylactic, an allergic reaction, a severe allergic reaction. They're very, very, very rare. Out of over 2 million vaccinations in Canada, I think there's been 200. or less, I think 100 anaphylactic reactions.
0.1,
Is really, really small.
0.1. Mm-hmm.
Yeah, so it's quite small. So it's a very small chance, but that would be one of the rare things that could happen. But other than that, it's exactly as John said. It's ranging between nothing. When I got my vaccine, I had just a sore arm. That was it, and I was perfectly fine. To some people might get a mild fever. So that's usually these milder effects are the signs that your immune system is working. This is the effect of your immune response. If you don't feel these things, it's okay, you're still working, but they're not concerning for your health.
Yeah. So I think the PEG is found, or the polyethylene glycol, in both Moderna and Pfizer vaccines. There's also polysorbate 80 in the AstraZeneca vaccine that people may want to just chat with their physicians about as well, just in terms of any sort of reaction. But other than that, like Kim mentioned, they're typically very mild to moderate effects after getting the vaccine.
So 2 points then, 2 points really. One of them is, maybe September, October last year, we can be having a different conversation. It's now March of 2021. Millions have taken all 4 vaccines.
Yep.
Okay. And
350 million.
350 million taking the vaccine, and we've had maybe, the AstraZeneca obviously is a little controversial in the Europe versus North America, but Dr. John, you took it, you're fine. I've had a couple of my seniors who told me they went to Shoppers Drug Mart and took it. Okay, so the fallout, if there was such a situation to be concerned about, where is the fallout? Is my point. Okay, and again, common sense. Okay, yeah, we can have a debate last September, but we're in March now. Okay, let's apply some common sense here. Okay, as we're evolving and seeing, now there are strains coming on for the most part, right? But obviously, God is providing, expertise and a solution of some type to beat this evil that's trying to, destroy humanity, if you want to call it that, right? And that's why we're having this conversation today in a balanced perspective of our spirituality and our physicality as well. But the other point I wanted to make to you then, so based on what you're saying there, then it behooves all of us who are listening to still make sure and check in with your practitioner, and don't just walk up to Shoppers Drug Mart and say, "Give me the vaccine." Can you help me with that? Because right now it's saying you can go to the Shoppers Drug Mart or you can make an appointment, but what you're saying is apply some common sense there as well, right?
Yeah, I think if you have a health concern, like if you've had an allergy to a vaccine, not if you have an allergy to anything, really if you've had a reaction to a vaccine, that's the only condition where you'd want to have a conversation. Otherwise, yes, you can go walk in and get your appointment going. If John has anything else to.
Dr. John?
I think the thing that virtually every pre-existing condition you could possibly have means that if you got COVID on top of that pre-existing condition, you would do badly. Okay, so if you have high blood pressure, if you have diabetes, if you're obese, if you're pregnant, a whole pile of things, in those situations, if you got COVID, you would suffer worse. So these are all actually reasons to get the vaccine rather than reasons not to get the vaccine. And the other thing with the allergies, it really only applies to people who have a proper anaphylactic response, where their throat swells up and they have difficulty breathing, or people who have specific allergies to vaccines or to things like polyethylene glycol and polysorbate, which are exceedingly rare. So if you have your normal run-of-the-mill pet allergy, if you have antibiotic allergies, if you have food allergies, if you have dust allergies, pollen allergies, all those things, we're not really worried about those things at all. And when you go to a pharmacy or go anywhere to get the vaccine, they will ask you a whole pile of questions, and there will be a survey that you will have to fill out. But the vast majority of people, these vaccines have no concern and enormous benefit.
All right. And I've told
I
our
just wanted to say, I'm so
Go ahead.
sorry. I do have to just hop off the call, sadly, but I just wanted to say it's been a pleasure, although very short, to be here. And of course, you're in great hands with Kim and John.
Well, we're gonna have you come back all by yourself, and we're gonna put you to the ringer, okay, Krishana? Listen,
No problem. This has been
thank
fun.
you.
It's been short, but super fun for me. So have a good night, everyone.
Wonderful. Blessings on you. Thank you so much for joining
Thank
us.
you so
Bye.
much.
So
Bye.
the remaining questions are not too complicated, but you've kind of led into some of the other ones you saw there in terms of whether you're on insulin, whether you're taking inhalers, whether you're on blood thinners. You mentioned having a chill. Those were some of the things that question 7 and poses there as well. So maybe we can just add some more to that for us as a flavor there, Dr. John. Okay.
Kim?
Sure. Yeah, I'll add a bit. So I'll skip ahead to, I see like the next few questions kind of tap into the same subject. So Question 8, for example, if person has severe side effects, are the vaccine centers equipped to handle? Yes. This is the monitoring. When you sit after you get vaccinated for 15 to 30 minutes, they are definitely equipped. Usually it's in some sort of healthcare setting. You're in a hospital, you're in a pharmacy, you're somewhere with professionals who are there and ready to take care of you. Beyond that, if you have anything that happens after, definitely consult the physician right away as soon as if you have any increasing or worsening symptoms that develop. And I want to also just make a more general comment about side effects, and I think that might also dip back to the develop too soon question. Typically with vaccines, if there's a side effect, because people often ask, what about the long-term effects? We don't know the long-term effects. For any side effect that's going to happen with the vaccine, it's going to happen most of the time right away, within a few minutes or within a few days. This is because that's when the vaccine is in your body. You are clearing out the contents of the vaccine quite rapidly. That's the point of the immune response. So it's really a couple days that the contents will be in you at most. So if you're going to have a reaction or anything, it's going to happen really rapidly. Longest typically is 2 months, maybe 3 months. So you don't, when people talk about long-term effects, we're not really looking a year, 2 years in the future, because there's no mechanism really for a long-term, it's never happened that someone got vaccinated and then 10 years later they had a complication. So that's why I think, the trials did happen in an appropriate length of time, and they were able to test and identify any effects. And yeah, so I just a bit of a side note.
No, but that answers seriously the rhetoric that you're hearing out there that the vaccine is going to kill more people than the virus. Okay, all right.
Yes,
And the
I do
long-term
hear
effect, of course. I mean, I got it today because I was on the flip side. I was getting warned today about stuff I should be viewing and reading in anticipation of the meeting tonight, because they figure the pastors should be knowledgeable on both sides. Okay, and I've been and they don't know. I've seen all the videos for the last year. Trust me, I've been exposed to all of the good and the bad for the last year. But I wanted to mention that somebody specifically asked about operations, and they mentioned there that if you had a kidney transplant, for example. Is there any concerns in those areas for taking the vaccine if you had some kind of a serious transplant, or in this case they're saying kidney transplant?
One of the issues there will be if you've had a transplant of any sort, you'll probably be on immunosuppressants, and that means you might not get as good a response to the vaccine as someone who wasn't on immunosuppressants. But on the other hand, it actually also means it's more important that you do get the vaccine, because you're less able to fight off the virus. So again, it's one of those situations in which having the condition actually makes it more important that you get the vaccine.
Okay, excellent, excellent. Okay, so let's move to the next one if it's possible. I think number 9. And, oh, by the way, number 8 mentioned dizziness, nausea, chills, but that's along the same response we gave earlier on as far as side effects are concerned, right? Okay, so number 9.
You can go ahead, John.
I think we've already answered that. We don't know if there's anything more we can say, is there?
Okay, so it's the same things: thyroid, diabetes, and all the factors, right?
Yeah. Okay. And diabetics, we know diabetes generally limits your ability to deal with infections, and the diabetics are another group that do badly with COVID. So, in fact, they're another group that the vaccine is even more important for. I'm not sure thyroid disease affects either the disease or the vaccine one way or the other. I think that's not important.
Okay, right. So ultimately, the solution seems to be here is that the vaccine plays a critical part in all of the factors that are involved here, and we will know you will know firsthand within days, for the most part, if there are any effects that's coming upon you. Number 10.
Yeah, I'll go ahead. So if you get the vaccine and you get a fever, what medication should you take? I can answer this briefly, but I'll let John go a bit longer because he's got the medical background. So generally, the advice is to take, if you're going to take a pain reliever, like Advil, let's say, to treat a fever, to take it after the vaccine, not before. But you can certainly take something like Advil after the vaccine. But John, if you have any other.
Yeah, I think, first of all, there's physical measures, just like tepid sponging, taking a cool bath, taking off some clothing. Secondly, I think it's really better that you go with paracetamol, with Tylenol first, because both Advil and Tylenol are good for getting rid of fever, but Advil, which is ibuprofen, is also an anti-inflammatory, and there's some suggestion, and it is only a suggestion, it's not backed by any big science, that that might actually impair your ability to produce a response to the virus, and you may get less of an immune response. So in general, we're not recommending people take stuff before they get their vaccine. Wait to see if you actually have a problem. If you do have a problem, physical measures and Tylenol first. If you find that's still not helping you and you need to take Advil or ibuprofen, it's probably not a big deal, but keep that as the sort of the last resort.
Okay, yeah, because our doctor wanted to get a response, and she kind of shared the same concerns there as well as a suggestion. Tylenol is the best approach after the fact. All right, and so I have a couple more that is not here, but just since we're conversing, I was looking at, I don't see anything on our chat line, and Eula hasn't spoken up yet either. But so now I think Johnson & Johnson is the only one that gives you one vaccine. Am I correct? The others are in 2 stages, right? So can you address that in terms of maybe the whys, or why 1 and why 2, that type of thing?
I'll leave that one for Kim.
Yeah, it really just comes down to the way that it was tested in their trials. I don't think there's necessarily a strong logic to it. It's just whatever worked. They found with the other ones that you needed 2 to get a really strong immune response from their preclinical data, and from probably their phase 1 as well, where they would be testing, or phase 2, I guess, when they'd be testing dosage. And for Johnson & Johnson, it just so happened that the nature of that vaccine was able to elicit a strong enough response after 1 dose. In terms of how these might be distributed in the population, I don't know. I mean, it's possible, and I don't know if this is going to happen, but it's possible that there could be some prioritization for harder to reach communities, because Johnson & Johnson and AstraZeneca, well, especially Johnson & Johnson, let's say, because it's 1 dose and it has very easy storage requirements. You can stick it in the fridge, or keep it at a regular freezer for a longer term. In fact, I think it's just a fridge for long term. This is logistically easier for some communities, so it's possible you're going to see a prioritization that way, but I have not heard anything like that. I'm just speculating right now, but this is something that could be. So I've heard a lot of my friends say, "Oh, I'm going to wait for the Johnson & Johnson," and I just, in the back of my mind, I'm like, it might not be available to you. So we're going to have to see what's going to happen in real time when that one gets to us.
Okay.
And the other part of it is that they're now finding that this, the first shot of Moderna or Pfizer actually provides pretty good coverage anyway. So I think that's, even a single shot of Pfizer and Moderna does better than we were expecting, should we say, at least. So it could almost have been a marketing decision, and I think if they'd known how effective Moderna and Pfizer were as single shot vaccines, they might even have sold them that way.
Right. So let's talk about the guidelines that are in place as far as distancing and masking and stuff as we move along this path, and the possibility of maybe some more strains being exposed to that. But if you get the vaccine, tell us what we can and can't do, and if whether we should be somebody who has the vaccine, as well as whether we're more freer, or whether we still maintain some sense of protection with those who haven't.
Yeah. Well, I was going to say, I don't want to tell anyone what to do with their lives, but
I'll tell them. I'm the pastor.
I'll leave that for you then. But I think it's always good to just discuss risk, and that's what I think is a good way to think about it. Your risk is reduced. We're getting new data now that the risk of transmitting the virus is reduced, which is great. But if you're getting vaccinated right now, let's say you're one of the early people getting vaccinated, you're getting vaccinated in a world where there is still a lot of COVID circulating. COVID cases are starting to increase again, and there are a lot of people around you who are not protected. So we're nowhere near herd immunity. A lot of people are still vulnerable. Most people have not gotten COVID. So there's very little immunity in the population. So we have to factor that into how free, I guess, we feel, and how we play with our risk, and how it assesses that. So I know in my life, for example, I've received 1 dose, but I haven't really changed anything, because I hang around with people who are not vaccinated and who are at higher risk of severe illness. So I don't want to, even that small chance that I might get it and spread it, it's not worth the risk for me. So I have not changed anything in my lifestyle. We are seeing a different story in the US, but they're way ahead of us in their vaccination. They also have way more people who've gotten sick.
Yep.
So I think that's something we can look forward to once we reach a higher number of vaccinations and once the cases start going back down. You know, it's going to go logically. When we don't need these restrictions anymore, we're not going to have them.
Yes, I agree entirely with Kim. So, I mean, first of all, even the Pfizer and Moderna vaccines, they're 95% effective, which still gives you a 5% chance of getting COVID. So, and also public health is being very cautious at the moment, because initially the first research didn't look at whether the vaccines prevented you spreading the disease. They proved that they were very effective at preventing you getting the disease and getting sick and getting into hospital and dying. But the early trials didn't actually look at whether it stopped people spreading the disease. And so there's the concern that vaccinated people may still spread the disease. It seems now in populations where a lot of people have been vaccinated, the spread of the disease is going way, way down. So it seems likely that public health might have been overly cautious on this one. But for the moment, certainly the recommendation is that you get the vaccine to stop yourself getting sick and dying of COVID. And you don't get the vaccine to stop yourself having to wear a face mask. And so you should pretty much continue all the precautions that you have been doing until everybody around you is vaccinated. Now, having said that, I think realistically, a lot of people, when it comes to seeing loved ones or whatever, may just be a little bit more loosey-goosey about the law if they know that people have been vaccinated. And I can't blame them for that. I think we've had a long, tough time for a lot of people.
Yeah.
But ideally, you should try and stick to the rules as much as possible.
Okay. Excellent. Excellent. And I was going to ask that question, if you can still transfer it even though you get the vaccine. So that's a good response. I think we've exhausted quite a bit here. I didn't want to get into all the negativity because I think that's just not necessary. You've kind of responded to some of those questionable thoughts that we're hearing about, you know, in terms of our faith community and our minority community as well, in some of those issues we've addressed and the concerns we may have. So I'm going to let you all be now, unless anyone else has.
One thing I just want to say is, the current vaccines are remarkably clean and pure vaccines compared to what we've had in the past. And so some of the vaccine hesitancy comes as a leftover from previous vaccines, right? So when we first developed the polio vaccine, what we did is we deliberately weakened the polio vaccine, but it was still possible to get polio from the polio vaccine. There was still, tragically, a few people who actually got polio because they got given the vaccine. And that doesn't apply anymore. Virtually every vaccine we use now is either a killed virus or it's a virus particle or part of the virus. It isn't the whole virus, right? So there isn't actually a whole COVID virus in any of the vaccines. Certainly there's not a live COVID virus in any of the vaccines. All they are little bits of it, or instructions to make little bits of it. So there's absolutely no way you can catch COVID from a COVID vaccine. And the other thing is, there were a lot of impurities in older vaccines. A lot of the time they had to grow the virus in eggs. And so a lot of times people had egg allergies, were concerned about getting vaccines because there was still egg in the vaccine from the way it was grown. And also a lot of them needed a whole pile of preservatives. So there was stuff like mercury and other things that people could be allergic to or have concerns about. But the modern viruses are very clean and very pure and really don't contain very much except the active ingredients. So it's there's a whole pile less in there to be worried about than with older vaccines.
Yeah, good, excellent. And I think it's just, again, it's just discerning with common sense and not listening to everybody's opinion out there. Doesn't matter what the title is behind you, is seek the proper information from the proper sources. And I think, you know, with some spirituality and faith in the mix of it all, humanity is going to be okay. So listen, I want to
sorry, could I just jump in really quick with some I wanted to touch back on something just for a minute or two, something that you mentioned in the beginning. I guess back to the first question of, you know, is this going to be the end times, I guess, if there's no intervention with COVID? And you asked about as well the impact on the Black community. And I wanted to talk about that a bit because this impacts me. I'm biracial. I don't know, people can't see me. I think most people are on the phone.
But, I can tell,
Yeah, so certainly you know, my mom is of a Jamaican background, and I hear a lot of comments among my family members about not wanting to get vaccine and stuff. So I've had to persuade a lot of people because I care, and I care about their health, and I want This is why it's so important for me to know the information so that I can empower my family so that we can know the true information.
Yeah.
And I want to share that across the world, but in Canada too, and in Toronto, COVID has had the strongest impact on communities of color, and that includes Black people. And in Toronto, the data has shown that, Toronto, Black people account for 9% of the population, but 14% of the cases and 16% of hospitalizations. It has been unjust. So if we let COVID continue to rage through, some people won't notice. Some, very rich, privileged people won't notice, but some people are going to suffer a lot more than others, and it's going to be communities of color. Low-income families, low-income neighborhoods are going to feel the brunt of this and going to continue to feel the brunt of it. So it's very important to get this behind us and to make sure that we are included and we are represented, and no one's trying to tell us not to take vaccines, because we are also being targeted by misinformation. There's a lot of anti-vax campaigns out there that are specifically targeting racialized communities, and this is not okay. And we have to also arm ourselves and defend ourselves against these kinds of attacks. So I just wanted to comment on that a little bit more.
Thank you so much. No, that's very important information. 9% of the population, 14% with cases, and is it 19% hospitalized?
16% of the
16%
hospitalizations.
hospitalized. Wow, that's unbelievable. I always and again I echo the point to everybody I speak to. You are at higher risk to the virus than you are taking the vaccine.
Yep.
Which would you do? Right?
Yeah.
So excellent.
And in Germany, someone has said the virus is 100,000 times more dangerous than the vaccine.
There it is.
So that's kind of an interesting figure. But going back specifically to the Black community, we don't really know why it is that the Black community has been so disproportionately affected. And it may be socioeconomic factors. It may be that they're more likely to live in multi-generational families. It may be more likely that they have to do work that they have to do in person instead of remotely. It may be genetic. But one of the things that's in there is the role of vitamin D. And so vitamin D is necessary for your immune response, and particularly to protect yourself against infection. And it can be produced in the skin, and Black skin is less effective at producing vitamin D than white skin. So it's not by any means a cure-all or anything, but I think particularly if I was a colored person, I would consider taking vitamin D just in a normal dose, like 1,000, 2,000 international units a day. You don't want to take more than 4,000, because above 4,000 it gets toxic.
You might turn white.
Yeah, I personally take vitamin D, and I get my family to take vitamin D. If I have Black skin, I would be even more keen about it. It's by no means a magic bullet. It's by no means proven. It's by no means a guarantee. But I think this is a very bad time to be vitamin D deficient. So I think people should seriously consider just taking a regular, like a multivitamin or a vitamin D vitamin.
Well, listen, you set me up for a great sermon message here, because you think about this, okay? One of our themes for our church this year is bask in the sun, S-O-N.
Yeah.
Bask in the sun. But you think about our color, right? And where do we survive the best? Where the sunshine is, right?
Absolutely.
So it all makes sense in God's providence and God's design. And I in particular, I take vitamin C and vitamin D every day with my family. We've been doing it since the kids were small. And I also take some other factors as well to make sure. And the important thing I think we're getting out of this is to look after your health and your immune system. It doesn't matter whether you're a Hindu, a Muslim, a Christian, doesn't matter whether you're tall, dark, or rich or poor. If you don't take care of your health, if you don't eat smart, watch your obesity, watch your intake, and take the proper nutritions for your body, then you really are almost creating this environment for God to use what he's given to you to fight against all these illnesses and diseases and viruses. And that's what we preach it as well, right? So we want to first of all say thank you, because I think we've exhausted our time with you. Wow, you guys have enlightened us and exposed some of the myths that we probably were all have a bit of concerns about. And I want to say a personal thanks to all three of you. We had Dr. Krishana for just a while, but we appreciate her coming on. She had two, as she said today, and both of you as well. So Kimberly and John, Dr. John and Dr. Kimberly, my sincere appreciation, and I want to give you a hand clap. I think the rest of us are going to be hand clapping and jumping on benches and chairs wherever we are in our homes and clapping and saying thank you, thank you. And there's our deacon chair is clapping as well. So we will let you go unless you have anything else for us. We would let you go. I will do a follow-up with Grace and a wonderful thanks to you as well through that
Okay,
means
you're
with
very welcome.
the COVID Resources Canada. And God bless you both and give you continued wisdom in your leadership to guide us through this time of our lives. All right. Thank you, Dr. John. Thank you, Dr. Kimberly. You're free to go now
Thank
because we're going to wrap it up now and say a blessing on both of you. Okay.
Well, thank you all so much for having us and for hearing us.
Thank you.
We really appreciate being among you.
You're more than welcome.
Okay.
Bye-bye.
Have a good
Bye.
night.
Okay. Bye. But I hope that you were blessed and enlightened today. I'm just going to leave you with Psalms 91. Don't forget, okay? The Most High God. He is the Most High God, Elyon, the Most High God, the El Shaddai. Amen. The Jehovah and the Elyon. All of the above. All right. So go in God's grace.